Hello, I'm Dr. Ben Newman, and I'm a coronavirologist. Let's get to your questions. Next question is a long, many part one, and that's fine. Let's address the parts. Yeah. This is from Nikki, and hello, Nikki. Good to hear you. Okay. So, firstly, I've been classified as extremely critically vulnerable by the government. Yeah, okay. Yeah, I don't know. I think I think that's meant to sound as though somebody's looking out for you and trying to take care of you. It sounds weird though, like you're vulnerable. I don't know. Yeah. But I get what it's doing, and there may be some benefits to that in terms of vaccination, access to medical care, stuff like that. So, fine. Let's see. My entire family got COVID just after Christmas. My husband wasn't hospitalized, but very near to. Meanwhile, I didn't have a single symptom, but definitely had it, although I did get several autoimmune low level issues as I have two autoimmune diseases. Okay, yeah, fine. That's good background. And yeah, I'm sorry everybody got the coronavirus over Christmas. That was the case in a lot of households. Yeah, we're still kind of digging out from that one here, almost, what, 2 months on? Yeah, almost 3 months on. Yeah, crazy. Okay. So, the big question, first question, how long do I have immunity for? Answer is nobody can say for sure just by looking at you or just by knowing when you were infected or what conditions you have. Um, there is a lot of variability, even among seemingly healthy, normal people, in terms of how much immunity they will end up with after vaccination or after the virus. Um, Now, it tends to be more consistent immunity after vaccination than after the virus because the virus tries very hard not to be seen by your immune system. It's got all kinds of these little cloaking measures, which are really neat, but yeah, ultimately, they're part of what makes the virus so bad. Um, yeah, so I don't think so. The closest anyone could get to giving you a real answer, which I would imagine is what you want, is if they were to do something called an ELISA test, ELISA, ELISA test. And if their ELISA machine is able to give out a number rather than a yes or no, because if what you're saying is correct, then the answer is already yes, and you kind of know that. But an ELISA machine would be able to measure the amount of antibody you have circulating around. And there are a couple of papers. It's not an exact calculation. There are very wide error bars on this thing, but you can roughly estimate that if you have over a certain level of total antibody, then you'll have enough of specific kinds of antibody and all the other parts of the immune system to probably, on average, do some good. That's the idea. Um, and that's about as close as we can get at the moment. The actual test to determine whether or not you would be protected would be a thing called a neutralization assay. But for those, you need a scientist to run it with your actual antibodies from your blood in a laboratory and actually grow up live virus and try to block it. See if you can block it from getting into a cell. And so that's not a thing that is cheap or quick or routinely done anywhere, I think. So, yeah, like the test exists, but it's not one that is widely available to the public at all. At all. Okay, next part. How does that immunity stand up against the South Africa variant? Pretty well. Not amazing, but pretty well. All the vaccines seem to work fairly well against the variants. But the South African variant seems to be, or this cluster of variants that we call South Africa or B1351, those seem to be a little bit harder to knock out than, for example, the thing that's called the UK version or the LA or the New York or the any of the other ones, Brazil variant, yeah, whatever, 20A, 20B, yeah. Um, but in the average person after vaccination, you should have enough antibody. The vaccine does such a good, consistent job that you should actually start out with enough antibody to knock out even the South Africa variant. And it's only over time you would probably need to be revaccinated sooner. But again, it's one of those things where most people's the guidance they would be given would be just based on like a formula or a guess. The tests can be done, and it would be that same neutralization test I told you about, but there's no good way to do that widely at the moment. It's very labor intensive for each sample. Yeah, there just aren't that many people to do the tests. Yeah, I guess we could do it. It's a pretty high skill thing. It's not where you could just involve every person in the military, for example, and have them run these tests every day. It takes a lot of training. Yeah, so there we go. All right. How do the Pfizer and AstraZeneca stand up against the South Africa variant? Pretty well. A little bit less than full effect, but still pretty good effect. And they, most importantly, are very effective at reducing severe disease and death due to COVID-19 with every single variant that's out there. So that is good news. And yeah. So there are more people who get sick despite being vaccinated if they're exposed to one of these new variants, but there's still a much reduced rate of death or really severe sickness if people have been vaccinated. So the vaccine is really good. Yeah, I would say. Let's see. I've had the first part of the Pfizer and the second part coming up. Yep, that's fine. Okay, and now the big question. Yeah, so I got a letter from the UK government saying I need to shield even after both parts of the vaccine. Why is that? And yeah, I don't understand. Why are we all marching on aggressively with vaccines if I'm no better off? Yeah, that's a good question. All right, here we go. So what we're doing is conducting essentially a worldwide scorched earth campaign against the virus. What I mean by that is that in the scorched earth warfare, you would normally try to just burn everything. No supplies, no food, no water, whatever. Just make it as difficult as possible for anybody to survive in that area in the hope that this will put pressure on the enemy and eventually you'll win. Yeah, so fine. This is a thing that has been done. What we're trying to do here is take away potential places where the virus could go. This virus can't hang around indefinitely in a person, as far as we know. It basically has to keep jumping from one person to another, to another, to another, to another, every couple of days. Otherwise, the virus gets wiped out by your immune system, and that virus is dead and gone. So if this virus can't get out of a sick person and right into the mouth or nose, probably not wearing a mask, of somebody else, within a fairly narrow range, usually around maybe 3-4 days, then the virus is dead. It is gone. And so when you look at it from that point of view, it's like, how could we mess this thing up as badly as we have? We have, yeah. But it's not impossible at all to stop this virus. So with a vaccination, what we're trying to do is take away potential hosts for the virus and basically just choke it so that it can't find a place to grow and it has nowhere left to jump. And this has got to be a process that involves everybody, everywhere, the entire Earth. Because even when we're vaccinated, the vaccine gives you, at best, about 90% protection if you get certain vaccines, and maybe like 70% with other ones. Which means still, 10 to 30% of people that get these vaccines are going to get sick if they are exposed, if they are not taking precautions. So it's not so much that you should take precautions, it's that everybody should take precautions. That's what it is. And we are pushing the vaccine. I'm just a guy commenting on it. The vaccine is being pushed because that is the best way to do this. If we could get everybody to wear a mask fully and properly all the time and have zero contact with other people, then we wouldn't necessarily need vaccines and the virus would go extinct. It would just be a universal quarantine, every single person on Earth, and then no more virus. lockdowns are unpopular, really hard on some people, and they can, yeah, have bad consequences. So the vaccine is the option that's not a lockdown, but still gets the same job done, and is ultimately maybe even more effective because even in lockdown, just from the bare logistics of the thing, generally people are allowed to go out to the store and to get gasoline or whatever. Yeah, and so there's still some exposure, still some risk, and still some transmission. Yeah. Yeah. So that's the explanation behind it. I hope that made sense. And if it didn't, I don't know. Send in some more questions, and I'll pick up whatever pieces I missed this time around. So thank you very much. This has been Ask Dr. Ben.